Welcome, everybody, back to the East Meets West podcast on health and medicine. I am your host, Dr. David Cherian, and we've been doing our podcast now. And here we talk about health and disease from both a Eastern and Western medical perspective. For those of you who don't know me, if this is your first time tuning in, I am a acupuncturist who practices Chinese medicine in Houston, Texas. I'm also a board certified family medicine physician in Houston, Texas. And we just talk about lots of different diseases from both a Western allopathic perspective and then also from Chinese medicine and how the two are different, if there's points of complementary work between the two, and how Chinese medicine may be able to help you to get the best outcomes and help you with whatever disease that you're suffering from. A lot of our patients have tried Western medicine for different conditions and hadn't got quite the results they were hoping from or are looking to get better results. And so that's one of the most common things that we see in our clinic. And it's from a variety of diseases. If you look through our podcast list or our YouTube channel, where we have a few more videos, we really go through a whole wide scope of different diseases. And part of the reason for that is because in Chinese medicine, you really need to know the whole scope of medicine to be competent in even one area. It's not like Western medicine where you specialize or focus on an organ system. In Chinese medicine, any organ or potentially any organ could potentially cause any sort of disease, although there are common pathways. And so it doesn't make as much sense to specialize in different organ systems in Chinese medicine. And so that's actually why on our podcast and on our show, we really go through a wide spectrum of diseases. We talk about gynecologic problems, we talk about pulmonary problems, and today we are going to talk about a neurologic problem, and we're going to talk about Parkinson's disease today. We'll talk about what it is, how we diagnose it in Western medicine, what are some of the treatment options for it, and then we'll talk a little bit about it from a Chinese medicine perspective. So I think it's going to be an interesting topic today, and so let's get right into it. First of all, just a little background on Parkinson's disease. It was actually initially called shaking palsy. Shaking, as in like tremors, shaking your body. It was called shaking palsy. And it was first described by a guy named James Parkinson over 200 years ago. So it's a longstanding studied disease. And Parkinson's is characterized by being a disease that begins in adulthood. And it's a neurodegenerative disease, meaning it affects the nervous system, the neurons, and it causes degeneration. And Parkinson's happens when there's a loss of dopamine containing neurons in the brain. Dopamine is a substance that is essential to help the neurons communicate with one another. And in Parkinson's, the neurons are specifically located in the area we call the midbrain. And there's a specific name for the area. It's called the substantia nigra and the locus ceruleus. And this area of the brain balances out another area of the brain called the basal ganglia. And that area uses a different neurotransmitter. And the two kind of balance each other out. So in Parkinson's, you have your dopamine pathway with the neurotransmitter that uses dopamine that is unbalanced versus the acetylcholine pathway. And so it can cause the wide variety of symptoms just based on the various areas and the degree of unbalance that happen. And that's kind of the broad view. And it impacts kind of the treatment options because a lot of the medications are used are targeting dopamine and that neurotransmitting process. Um, so that's a little bit about just the background of it. But on a practical level, the question is, what do you see? Like, what are the symptoms of Parkinson's? And first of all, the average age of diagnosis is 70 years old. So some people might get it a little bit earlier, some people might develop it a little later. Usually there's some phase, maybe a few years, where people have some mild symptoms and it doesn't really affect them that much. They maybe just brush it off as something else. And then symptoms might continue to progress to the point where they actually go to a doctor, try to get it diagnosed, try to figure it out. And then that's why we say the average age of diagnosis is around 70 years old. So we'll talk about, there's a wide variety, a myriad of symptoms that Parkinson's disease can cause. And we'll just talk about some of the most common presentation symptoms. So probably the most common one is tremors. And like I described earlier, that's when you have a shaking movement, and it typically is in the arms, although it could be in other areas. And in Parkinson's, we differentiate this as being a resting tremor. And that's important to know because there are other types of tremors. There's something called essential tremors, and there is also the Parkinson tremors, which is a resting tremor. And so a resting tremor is when you are just kind of in a relaxed position, not doing anything particular, and you have shaking. And most commonly, we think about the arms or the hand shaking. And the the difference is when you actually start, let's say you have a resting tremor in your hand and it's shaking. Now, when you actually try to go and do something with the hand, like let's say you were going to go pick up a pen or pick up a coffee mug, when you start using it, that tremor slows down and even stops. And that's a resting tremor. Now, there are other types of tremor where you're fine when you're sitting there, but then when you go and try to do something with your arm or your body part, then it starts having a shaking movement. And so differentiating both of those types are important in Parkinson's disease. And Parkinson's tends to be the resting type tremor. There's a specific term that we use for Parkinson's tremor, and it's called a pill rolling tremor. And it kind of looks like the thumb and the fingers are rolling a small object, like a pill between them. And so that is a characteristic tremor of Parkinson's disease, and it's called a pill rolling tremor. So that was one of the characteristics. The second characteristic I was going to talk about was slow movements, or bradykinesia. Bradykinesia, that's the technical medical term. And brady means slow, kinesia means movement. So putting them together means slow movement. And this is a symptom that it can be hard for patients to describe, especially initially, because they may feel like it's a weakness or a coordination problem or just feeling tired. And then it can progress, and sometimes patients may notice they have difficulty with things that require more fine movement, like buttoning your clothes or tying a shoelace, typing, um, and and those are examples of bradykinesia. It's a slowness in the movement, and it's also a decrease in the amplitude of the movement, like the distance of the movement that you would typically do. So, for example, in Parkinson's disease, patients usually start taking smaller steps. We call it a shuffling gait. They might drag their legs a little bit more. And those are examples of bradykinesia in the legs. So commonly, patients with Parkinson's disease may have difficulty standing up from a chair, getting out of a car. Those are all various examples of bradykinesia. And then the last symptom that I'm going to just briefly discuss here is rigidity. And rigidity means that when you try to bend another person's joint, it feels hard and stiff. and rigid, and it's hard to bend it. Usually, if somebody's just sitting there relaxed and you want to just bend their wrist a little bit, it's fairly easy to do that. But in Parkinson's disease, it'll feel more stiff, and the patient may themselves notice stiffness or notice pain. And so that's an example of rigidity. There's also other things like postural instability, and that basically means that your posture is a little bit unstable, you're at a bigger risk of falling, and that can actually be a really frustrating component because it affects a person's mobility, it affects their ability to get around the house, be independent, do things that they used to previously do. So that can be pretty disabling. There's a lot of other symptoms that can go along with Parkinson's disease, and it can affect your ability to think. It can cause dementia, sleep problems, fatigue, hallucinations. A lot of different things can be part of it, but the ones that I just mentioned are the kind of the main core symptoms that we think of and look for in Parkinson's. So all of that being said, to officially diagnose Parkinson's disease, it's really based on the history and then doing a neurologic exam. Unlike other diseases, we don't really diagnose Parkinson's with blood testing or imaging like MRI or CAT scans or any of those things. Your doctor might want you to do those things for the purpose of making sure it's not something else that they're missing, but we don't do them to try to get back a report that comes positive for Parkinson's. That's just not how it's diagnosed right now. The main way, like I said, is to diagnose it based on the symptoms. So for Parkinson's, to diagnose it, you actually have to have bradykinesia, or that slow movement, which we talked about, along with either tremors or rigidity. So if you have two of those, then you can diagnose it. And typically, you also want to do a medication trial to verify whether it is or not. So one of the things that your doctor may want to do is, if they suspect it's Parkinson's, they may go ahead and prescribe you the medication. And the question is if you respond or not to the medication. If you respond to some of these dopaminergic medications and your symptoms get better, then that tells us that the decrease in dopamine is a problem and this is Parkinson's. But let's say you take the medications and everything is just the same, you don't notice a single thing different, then that can also rule out the disease, and it might prompt your doctor to look for something else. So doing a trial of medications is very helpful for establishing the diagnosis. And then we'll talk a little bit about treatment options. And I'll talk about it from a Western medicine perspective, and then we'll do a little bit on Chinese medicine. One of the first things to understand about treatment in Western medicine for Parkinson's disease, and I think this is probably a crucial point, is that all the medical treatments are symptomatic, meaning that the goal of the treatment is not to cure the disease or make it go away, but really just help the symptoms not be so problematic for your life. And although we would all like to have it cured right now in Parkinson's, the majority, all the treatment is available that is to help with symptom treatment. And again, it's not changing the neurons in the brain and what's happening there. It's again helping to, most of the time, it's helping to increase the dopamine that is available and how effective it is, and to treat the symptoms. So typically, it's treatment is usually started medication-wise whenever your motor symptoms are beginning to really affect your ability to do daily tasks, affect your quality of life. And the first line treatment and the most common and established treatment to date is still going to be levodopa, and most people take it in a form called carbidopa-levodopa, commonly known as Sinemet. It tends to be the best and most tolerated medication, especially in terms of improving motor function and activities of daily living and quality of life. Usually it's in a 25 to 100 milligram, 25/100 milligram dose 2 to 3 times a day. And it can be titrated by your doctor for whatever dose you need for symptom control. Uh, Common side effects of carbidopa levodopa: nausea, dizziness, headaches, and you are going to definitely need to follow along with your neurologist over time to make sure you're on a right treatment dose. Um, there are a number of other alternatives in terms of medications, and I'll talk about one other class of medications. It's called the monoamine oxidase inhibitors. And one example of this is selegiline. And one of the benefits for these class of medications is that they can potentially be once a day, which is a major benefit for patients. They tend to be less potent, less strong in terms of the dopamine effect. They can have more side effects. So, like I said, it's not usually the first line option, but it is definitely used in a lot of patients. There are other medications like pramipexole as well, and we won't go into all of those just so that we can also focus a little bit on the Chinese medicine aspect, which I did want to talk about next. So getting into the Chinese medicine aspect of treatment for Parkinson's disease, I always mention this anytime we talk about any disease, but it's very patient dependent and very unique to each particular circumstance. So very rarely are you going to have two people who have the exact same type of Parkinson's when we're talking about it from a Chinese medicine perspective. Just like everybody is unique, just like you have a unique thumbprint, so also we get unique diseases, and it works differently from person to person, and everyone needs a unique approach in their treatment protocol. And so, all of that being said, I'll talk about it from a little bit more of the common underlying problems that we see. Uh, I would say probably one of the most common underlying causes is what we call yin deficiency, along with internal wind, and they often go together. They are two separate disease entities. Wind tends to be one type of entity, and yin deficiency is another independent type of entity, but they do have a relation. In Chinese medicine, the yin energy is it's the substance energy of the body. It's like the nourishment energy of the body. And two of the main organs that are involved in the yin energy are the liver and the kidneys. And over the course of your life, they tend to become depleted over time. It's kind of like a candle that uses up its wax over time. You can kind of think of the yin energy like that. Over the course of your life, you go through the wax of the candle and it burns off. And so over your life, you use the liver and the kidney yin energy. Now, when the liver and kidney yin energy gets depleted, it can cause heat in the body, and it can cause the yang energy to be overbalanced and to start rising. When that happens, it can result in internal wind in the body. And so the wind is what's responsible for a number of the symptoms, such as dizziness, tremors. It can cause weakness. It can cause other things like seizures, difficulty speaking. It can manifest in a wide variety of ways, but it can manifest definitely with the symptoms we see in Parkinson's disease. And so it's the treatment approach in Chinese medicine to Parkinson's disease caused by yin deficiency and internal wind is a little bit of it's a two-pronged approach. We're going to want to nourish the yin energy, support the yin energy of the body, and at the same time, we're going to want to extinguish the internal wind, try to subdue the wind, and help the body heal on its own. Now, from an acupuncture perspective, there are points in the body that we do use to extinguish wind, And that's going to be one of the principles that we look at when we select the points. So, for example, one of the key points in extinguishing wind in Chinese medicine is the point called gallbladder 20. It's at the base of the skull behind the head. And those points, that point on both sides, is helpful to remove wind from the body. So that's a commonly used one. And actually, interestingly, the gallbladder channel has a number of points that can be used for wind. Another one is on the leg, and it's kind of on the side of the leg. Um, and that is gallbladder 34. That's also a helpful point. And then when we talk about supporting the yin energy in the body, like I said earlier, a lot of the yin resides in the liver and the kidney. Those are two of the key organs to help the yin energy of the body. And so for the yin energy, we do use the liver channel. And interestingly, in Chinese medicine, the liver and the gallbladder are two organs that are paired together. And so the liver point that we would use, for example, is liver 3, which is on the dorsal aspect of the foot. And that's a good point to help with supporting the liver, improving the yin energy of the body. So interestingly, when you look at it from a Chinese medicine perspective, even though Parkinson's disease, even though we think of it as a brain problem or a neuron problem in the head, a lot of the points are actually not points that are, you don't necessarily use points right on the head. You use some, but not all. And a lot of the points are on your legs, on your feet, some on the arms. So it's kind of interesting from a Chinese medicine perspective, and that's because we are looking at the organs that are involved and treating the channels associated with those organs. So that's a little bit about the acupuncture side of Parkinson's disease treatment. And then the other thing I wanted to talk about was the herbal treatments. And in our clinic at Houston Acupuncture and Primary Care, we place a major emphasis on herbal treatment, pretty much for every condition. And I really believe that that's a crucial part of improving your health and really getting at the root of disease. And so for example, in Parkinson's disease, again, it depends on what your actual underlying problem is. But if we are going to use the example of liver yin deficiency and wind, there is a formula called Zhen Gan Qi Feng Tang, or in English, it's called sedate the liver and extinguish wind decoction. And this is just an example of the type of formula that we may use and probably modify to a certain degree based on your particular condition. And it's a formula that was written in the early 1900s, and it's somewhat of a well-known formula in Chinese medicine. And it's a formula that helps to extinguish wind and nourish the yin energy. So two of the key herbs in there is Niuzi and Daizi Shi, and both of those herbs are working together to nourish the liver, nourish the kidney, tonify the yin, and also direct the yang energy downward and reduce the wind, reduce the tremors, and really get at the root of the problem. And so it's a formula that calms the liver. It is a pacifying type of formula. It's a nourishing type of formula. And there's a number of other herbs in there that can also help assist with those functions, like Gui Ban, Tian Men Dong, Bai Shao. Those are all additional herbs that are in there to really solidify the treatment plan. So just concluding today, Parkinson's is characterized by tremors, rigidity, and bradykinesia, or slow movement. And we talked about some of the diagnostic criteria. We talked about the treatment options, especially carbidopa, levodopa. And then from Eastern medicine perspective, using acupuncture, Chinese medicine, and treating the underlying issues such as internal wind and yin deficiency in the liver and kidneys as an example. So that's just a small taste of what we do at Houston Acupuncture and Primary Care, and specifically for Parkinson's disease. And if you have Parkinson's or somebody you know has it and you're looking for treatment options, Um, in addition or beyond the standard protocols, or trying to find something else that may be able to give you assistance, we would be happy to talk to you and hear your story and see if there's anything we can do to offer to you. I think Chinese medicine, acupuncture, herbal medicine is a fantastic option to consider, and we at Houston Acupuncture are uniquely positioned to really understand your health condition and make a treatment plan that works for you. So find out more from our website, www.houstonacupuncture.com, and we will see you next time on East Meets West podcast on health and medicine.